Welcome to the Nursing Procedures and Interview Preparation channel. Today we discuss IV cannula. We answer the following questions. An intravenous IV cannula is a small, flexible tube inserted into a patient's vein to provide a pathway for administering fluids, medications, or other therapeutic agents directly into the bloodstream. It allows for rapid and effective delivery, especially in medical emergencies or situations requiring continuous administration, such as intensive care. Key components in design. Needle. A sharp needle is used to pierce the vein initially. Cannula tube. A soft, flexible tube, cannula, slides into the vein once the needle is withdrawn. Hub. This is the point of connection where the cannula connects to IV lines, syringes, or extension tubing for medication or fluid administration. Injection port. Many cannulas come with a port for additional injections without removing the primary line. Types of IV cannulas. 1. Peripheral IV cannula, inserted into smaller peripheral veins, usually in the arms or hands, used for short-term therapy. 2. Central IV cannula, inserted into a central vein like the jugular or subclavian veins for long-term therapy or when high flow rates or certain medications are required. Common uses. Fluid replacement, for patients with dehydration or those needing hydration. Medication administration, for antibiotics, pain relief, and other drugs. Blood transfusion, for administering blood or blood products. Nutritional support, when oral intake is insufficient. Why IV cannula? Quick access to the circulatory system. Reduced need for repeated needle sticks, minimizing patient discomfort. Efficient drug delivery, allowing for faster onset of action. Possible complications. Infection at the insertion site. Phlebitis, inflammation of the vein. Infiltration, fluid leakage into surrounding tissue if the vein is missed. Air embolism, air entering the bloodstream, rare but serious. Proper technique, sterile practices, and regular monitoring help prevent complications and ensure patient safety during IV therapy. Why is an IV cannula used? An IV cannula is primarily used to deliver fluids, medications, blood products, and nutrients directly into a patient's bloodstream. It is commonly used for rehydration, replenishing fluids in dehydrated patients; medication delivery, administering antibiotics, pain relief, or emergency medications quickly and effectively; blood transfusions, providing blood or blood products to patients with anemia or bleeding issues; nutritional support, delivering nutrients intravenously if oral intake is insufficient or impossible. How does an IV cannula work? An IV cannula works by providing a direct route into the vein. Once the cannula is inserted and the needle is removed, a small flexible tube is left in the vein. This tube remains in place, allowing healthcare providers to connect it to IV lines for continuous or intermittent infusion of fluids, medications, or other substances. It allows quick access and continuous flow, which is essential for critical care and treatment. Where to insert an IV cannula? The preferred insertion sites for an IV cannula are usually peripheral veins in the hands, wrists, forearms, or in some cases the foot. In adults, the back of the hand or the forearm veins are commonly chosen, while the antecubital fossa, elbow crease, is used if larger veins are needed. In emergencies or special cases, central veins, like the jugular or subclavian, may be used with larger cannulas or a central line setup. What is cannula size? IV cannulas come in various sizes, measured in gauge G, which indicates the internal diameter. Smaller gauges mean larger cannula sizes. Common sizes include 14G to 16Gs. Large bore, used for rapid infusions or in trauma cases. Standard for adults. Standard for suitable for most infusions and blood transfusions. 20G to 22G, used for general fluid or medication administration. 24G, pediatric size or for patients with smaller veins. When should an IV cannula be changed? The cannula should generally be changed every 72 to 96 hours to minimize infection risk, though some patients may require more frequent changes depending on vein condition, medication being infused, and hospital protocol. Cannulas should also be replaced if they show signs of infection, blockage, or malfunction. How long can an IV cannula stay in? In typical cases, a peripheral IV cannula can remain in place for up to 72 to 96 hours, as long as there are no signs of complications such as infection, infiltration, or phlebitis. In cases where longer-term IV therapy is required, Central lines or peripherally inserted central catheters are used instead. Which IV cannula is used for adults? In adults, an 18G or 20G cannula is commonly used as it allows for most medications and fluids to be infused effectively and can accommodate blood transfusions. The choice of size depends on the treatment requirements, vein size, and the patient's overall condition. Can an IV cannula break? Yes, although rare, an IV cannula can break. This can occur due to improper insertion, excessive force during insertion, or kinking within the vein. If this happens, the cannula must be removed immediately, and medical attention is required to prevent complications like embolism if any fragment enters the bloodstream. Thanks for watching.